everybody. I'm glad you could join us tonight. Tonight, this is an interesting location I'm doing from my podcast tonight. We are at the Buffalo Airport right now, so if you see an airplane take off, there's a bunch of people over in the back there. But we're going to try what we're going to do is the first part of the webinar, we're going to have me start off with an interview with Kyley. She's going to be talking about her daughter. So just in a minute, we're going to do that. But I welcome everybody tonight. And what's going to happen is I'm going to have to board as soon as they call me, which is in about 20 minutes. And it'll be taken over by Dr. Heyman Bowen. And Kyley will continue to be there and we'll have some short videos, and then we'll come into a question and answer period, which this time I cannot be at because I'll be on the plane. So I want to welcome everybody tonight, and I think you're going to really enjoy this. So Kyley, if you want to come on. So Kyley is the mother of Rowan, and Rowan has had a lot of seizures, and you're going to find out about how we've been able to see Photobiomodulation be able to help with seizures. So in Rowan's case, so we're going to just bring Kyley, if you can turn on your video, and we will get going here. There we go. We got Kyley up. There we go.
Hi, Tom. Hi, everyone. Thanks for having me.
Hey, fantastic. A little different backdrop here. No SunPowerLED, but we are officially SunPowerLED at the Buffalo International Airport right now. So, Kyley, tell me first a little bit about how did you learn about PBM? What started this whole thing?
Oh, well, I was actually sitting in church, and we, every Sunday we were praying for something for Rowan to, be seizure free. And the lovely family behind me, Rob and Angela, they brought over a helmet to try with Rowan that you have graciously let us borrow here. So then that's what started it all off for us.
So did you how long before that did you know Angela and Rob, or how did they know about Rowan and your
it was situation? It was just about a year, and I was just kind of sharing our story, and Rowan's seizures kept escalating, and we were trying different medications. We were in the hospital actually, we were on a trip out east, and Rowan was having 56 seizures a day. So we were admitted to the IWK. And when we came back to Ontario, that's when they had reached out.
Wow. And so, you came back to Ontario. When was that? That was in February, or
we came back to Ontario. It was in September.
Okay.
And then I started kind of following up a little bit more on that. And that's when Rob it was February when he came, and he's like, I talked to my father-in-law. I think this would be something that would be great for Rowan to try. And at this point we had already tried, medication, CBD, so we were kind of at our wit's end. We just want some sort of relief, right? A child with refractory epilepsy, nothing was working. So
wow. And so Rob my son-in-law had asked me, hey, what do you think? And I says, I think, because I knew somebody else who had seizures, who had a fellow in his 40s who had seizures, and it totally helped him. So I thought, hey, I really think it could help. And the first treatment was a minute and a half. I had suggested to you to do 30 seconds with the helmet on. I can't display it right now, but it's on our website. So the helmet was put on for 30 seconds of the bright red, and 1 minute of the near infrared, right? That's what you did?
Yes, right before bed.
Right before bed. And what happened then?
Well, we went from having 10 seizures a night to only having two seizures that night. Um, Unbelievable. And then February 16th, we tried again. She didn't have any seizures during the day. And 8:06 p.m., we did a minute and a half of treatment. And we
That
then
would have been
were
the next. That was the next night then.
the next
So
night, yes. So we went February 16th, 17th, 18th, and 19th without having a seizure. Oh, it's
and
still, uh,
oh, it is beautiful.
yeah.
That is beautiful. And you got me now. Anyways, but here's you didn't increase medication. You didn't nothing like. I mean, you tried everything under the sun, or they tried everything under the sun. But only thing that changed was you added the light to
That
the
was it.
situation.
That was it. We had just added the light for just a minute and a half, and it was a year that we had went seizure free with this little girl. Um, just excuse me. Um, for like the first time we slept, I wasn't waiting for her to have a seizure. The fear of the unknown, not knowing what was going to happen next. Rowan has slept on my chest for the last 3 years, and just over and over seizure, and it was like I didn't know what it was like to sleep again.
Wow,
Hmm.
wow. And so I'd like to bring on also at this point Dr. Heyman Bowen, if as soon as you can, if you can bring your video camera or your video on. But Dr. Heyman is a medical doctor in physiatry. I always say that wrong. He'll clear it up. But so this is now since February of this year, and what has been happening so far. Like what's so I did ask you to about a month ago or a month and a half ago to double it, so twice a day, somewhere around there. You did it twice a day, each treatment being a minute and a half, right? Something like
Yes, we
that. So
do. We do morning and evening now. And
yeah.
we've been doing that. Actually, it was 2 weeks since we started the minute and a half, and we have not increased any of the treatment. It has now
Wow.
just, yeah. So
And Heyman, Dr. Boone, I'm gonna ask you. I'm sorry, we have such a close
Okay.
relationship, Heyman and myself. Dr. Boone, do you want to continue with questions for just a sec? I want to make
Sure.
sure that I'm not too late for my boarding here. So just I'll let you ask some more questions.
Sure.
And for those that didn't see the first part of the interview or my webcast, I'm at the backdrop here is the Buffalo International Airport. I'm flying out to Atlanta. We have the possibility of the first hospital that's going to first new hospital that's being built to take on our technology. So we're going down to Atlanta, and I'll be flying out. So it was rather short notice, but hey, I didn't want the webinar to stop. So hey, this is going to be fantastic. So um, Dr. Bowen, do you want to
Yeah,
continue
no,
on here?
no, Kylie. I mean, you've been. I can't even believe. I mean, I've met so many people with children who've had seizures, and it's sometimes the scariest moments. So I always listen to the mothers, right? I mean, mothers and parents, they know it when a kid has seizures. Now, I also wondered, like, did you guys have an QEG or EEG done?
yes, we've actually been Rowan is set up for an SEEG June 22nd. Actually, we just had in March of 2024, we had an EMU. We were there for a week at McMaster University. That's when she was having 10, excuse me, um, 5 to 10 minutes. She was having five seizures every 5 to 10 minutes.
Right.
They were silent. She was having the habitual seizures where the right side would go numb, or excuse me, would start flailing. She would start screaming in hysterics. It would last about a minute, and then she would just bounce right back to. So we've got all of this information on the two EEGs, the EMU stay, and now they will have to potentially have the refract or the SEEG June 22nd.
Okay. And also, I mean, when she has these seizures, how is she thriving? Like, how is she done, like school wise, activity wise?
The beginning of this year, she
Yeah.
was only able to do half days.
Yeah.
Rowan was having a lot of seizures during school. She had
Mm.
an EA. And then at Christmas, she started full time back to school. And 3 weeks ago, her teacher had her in the class and she had her first spelling test with her class where she had not had any frustrations. She wasn't breaking anything.
Oh wow.
And it was, the first time with all that repetition and with all of, I really chalk it up to the red light, and it just, she's really come a long way. It has been a process, but for the first time, like I said, we are actually getting that relief.
Yeah. No, that must be a huge relief on your part too. I mean,
Mhm.
that's the relief of knowing that your child is not getting their brain hurt, right?
Right.
Yeah.
Yeah. And that was the big thing in the beginning was like, if she continues to have these seizures, they could potentially show another part of her brain and they could
Mm.
jump to that other spot, right? I know I'm not I'm just learning myself still.
Yeah.
But with this, I do feel like it's really stopped those seizures. And so now we have it just triggered right in that frontal lobe. And no potential of any movement, right? So now
Mm.
we can get into that seizure, that SEEG, where we don't really have to worry about any other part of the brain. It's really
Yeah.
just stayed right in that frontal lobe.
Yeah. No, and that is a key thing. I think for anyone who's listening, like when Kylie was saying that refractory epilepsy, seizures, it just means that they were trying medications, you tried everything, and it's still, she was experiencing seizures, right? So
Mhm.
medicine actually, like in medicine, we have only a few things that we can do, right? We tell you, take these medications, change your habits, like maybe the sleep is the issue, maybe the diet, all that, right? The basic stuff that neurologists would actually tell you, or any specialist would tell you. And so you were like, from what I understood, was like you've actually gone through all that. You did all the right things, and you were still having problems. Also, one interesting thing was, didn't you reduce the medication dose as well as you went?
Uh, we did come off the topiramate.
Okay.
We now are
Which is an
only
anticonvulsant. Sorry for those. Yeah.
Yes.
Yeah.
So we are only on clobazam and cenobamate now.
Okay.
And we have been staying and maintaining at the 150 milligrams of cenobamate now for it's been 3 months.
Yeah.
So that's wonderful because we were up and down. We haven't had to take any of the lorazepam for emergencies. It's definitely, we're starting to feel, I even see now an aura. So I'm able to catch them,
Catch
which
it early.
is
Yeah.
very new, right? Where, I mean, I'm with her all the time now. It's fight or flight. Like you
Yeah.
don't know whether it's coming on. And now we're getting that aura. So it's
So aura,
really,
for people who don't know, is like what kind of a things does your daughter present? Aura is like sometimes a premonition for the people who are experiencing it, or it's the people who are watching it. They know that something's changing and they're about to have a seizure. Uh, so for your daughter, what was the aura that you typically experience?
so Rowan will look straight through you. She'll
Hmm.
she'll talk to me and say, "Mom, I feel one coming on," but you can see the red like flush. Her
Right.
whole body, her whole demeanor drops, and she's like, "One's coming." And it's now been about a half hour, and then we know within that half hour, one is coming. We're gonna get it, and you just hold her and go through it. It lasts again about a minute, and
Okay.
then she bounces, kind of right back within about a minute or two.
Curious, have you
Now,
tried?
am I
Sorry.
sorry? Can by the way, I'm not going to miss my flight
Oh, good.
because my flight has been delayed 10 minutes. So thankfully, I can
Hey.
stay another 10 minutes. But what I was going to ask you, did you now the Caesar length is different length as well, isn't it? It's a little shorter.
Yes, we were always anywhere from 60 to 75 seconds. Now we do have some really quick ones that are about 30 seconds. Um, it doesn't, the auras are still there, but the seizures aren't as long. They don't seem as aggressive.
So from the experience that we've had so far, for your auras, have you ever tried using a red light product like one of Tom's Palms or even the helmet when you know an aura is coming on? Do you ever put it on?
No, No, I
Okay.
haven't. And you know what? That was funny
Okay.
because I was talking to Tom just a few days ago about
Yeah.
my migraines, and he was like, "Get your
Yeah.
aura and put the helmet on." And then when with Rowan, I thought,
Yeah.
This is what I'd like to start to do. Right, catch that aura and then stop that completely. I mean,
Oh, that'd be fantastic. And then going forward even further, maybe I can get you one of the palm lights, the smaller palm lights, and see if you can even avoid it with the palm, because obviously a helmet is not as easy to pack and take with you wherever you go.
yes.
But a palm light, if you could use it and it would stop that, that would be
Yeah.
fantastic. By the way, I got really good news, everyone. That's my plane in the background that just showed up, so I'm very pleased. Good stuff. Anyways, no, but yeah, we should get you one of the palm lights, because maybe that's something that could
Yeah.
also be used.
Because what we
Um,
found is like, again, just to preface all this, it's just that we are still working on trying to figure out the evidence. We're going to back it up with a lot more evidence and studies, but from so far, like few people that we've already met and actually looked into, what we found is even with migraines, if a person gets an aura and we know the location of the aura, we tell them use that over that site, and they typically don't have that migraine that day. So because people know where exactly they're feeling it, and so the theory is that basically photobiomodulation, as most of you probably know by now, it just works on different mechanisms, right? So it works on mitochondria. It basically it activates a certain cytochrome, a certain part of your cell in the mitochondria to produce more energy. And then also it vasodilates. So the vasodilation part is the what part that we're thinking theorizing based on for migraines may be helping. Now, for seizures, again, it's multifactorial, right? And so seizures is different function, like different things that could be active, like that could be helped by light energy. And that includes again the energy, like the producing more energy cells, like ATP, but also vasodilation. There's also this studies that have said that it could lower the seizure threshold, like it could actually improve, sorry, the threshold. So that means actually you don't get as easily irritated to have that seizure. So there's possibly those things working as well. So definitely try it out when you have the aura. And also, I always worry, like when I was working with Tom, I always worried whenever he said, "Oh yeah, put it on, no problems." But I'm like, Tom, won't it hurt this person? I mean, like we're talking red light and everything else. And more I've worked with him, it's like, yes, the heat can do things, but it doesn't produce heat. And Tom's products actually produce his patented cooling system actually takes away the heat, so you can actually put the device as close as you can to the head, and not be put anyone at risk. And with children, especially, I'm very careful because these are more fragile brains. We always have to worry about it. Their skulls are thinner, and so forth. So we did look into it, and so far there's been no concerns. But
yeah, and I'll just mention. I'm still listening in. Um, the As far as usually it's not a minute and a half.
yeah,
Usually we're doing 1 minute of red and 3 minutes of near infrared with adults, is what we're doing. And then if a person has a migraine or a headache, we found it even needs the total of 2 minutes of red and 6 minutes of near infrared. So the length of time is longer for adults, and sometimes depending on the condition. I just thought I'd pump that in there
and
while we
also
have people listen.
and also it
Yeah.
depends, right? Because also you could actually use it based on we have just the units, like 1 minute, 3 minutes. The reason why Tom has used 1 minute, 3 minutes is that's the one that's been studied, especially for in terms of opiate addictions and depression scores. So that we know safety wise we're okay there. And you could use it in multiples. So basically 1 minute, three, and you could do it again as well. And it works. But I'm curious to know how you do when the aura comes on. Um,
yeah, that'll definitely be something, to now that she's having it with the temperature increase too, with the summer
Oh,
weather, we
yeah,
do find that her seizures do seem to escalate in the heat. So she's been coming home really lethargic, and that's when she's feeling the auras. So it's usually every day. So tomorrow, let's go all gung ho and see if she'll have that aura again at the end of the day.
right,
Um, and then I can definitely test it out from here on out with the nicer weather, right? And the
right.
heat increase.
Yeah. And also, I mean, of course, do everything else has to be the standard of care is basically make sure that she's getting the proper sleep, and that the helmet helps with. Sleep actually has been shown improves the lymphatic system, the circulation there. We That's one thing that probably, if you've also done it on yourself, that's one thing that we
Yes.
found with the helmet and the palm is that the common denominator for everyone is that sleep. They all benefit from sleep. As far as the people who are highly optimized, they don't notice much of a difference, but the ones who do, most of us have some sort of inflammation or vasoconstriction, so they actually benefit quite a lot from sleep. So sleep also is very important for seizure patients, right? For
Hmm.
patients with epilepsy, if they don't have if they have sleep deprivation, they're prone to have more seizures.
Right. And that seemed to be where she was always having her seizures. Hi, Rowan. She was always having her seizures in the evening. There would be the odd one throughout the day, but there was almost 20 in the evening, right? Or at night while she was sleeping. So she was never really getting any of that rest.
Oh,
Uh,
wow. Okay.
she had the black under her eyes, and then they diagnosed her with ADHD. So then they had her on bifenton, and when we did start with the red light, that ended up it really started to control her behaviors as well. And so I took a step back from the bifenton because she didn't need it, and I didn't want to just keep adding on more medication, more drugs for her when we were finding some relief in this, And now, when we did do the EMU and we went to sick kids, we didn't have the therapy. So we stopped the helmet in April 21st, and we were there for a week. And when we came back, her behaviors had escalated.
Oh,
She was not able to, it was more like she couldn't control things. She wanted to hit. She wanted to. She was so defiant, and then we started the red light again, and it seemed to relax her. It seemed to calm her.
no, that's just so important. And I'm glad you actually are still, the medication wise, you were careful using, I mean, watching that because one thing that we notice also with thyroid patients, like hypothyroid patients, they're on several thyroxine or the levothyroxine. And what happens is when they're using the palm, if they don't take care of the medication, like reduce the dose, they get affected because what happens is the red light stimulates and actually improves things that they have to lower the medication. So otherwise, they get into this edginess and everything else. So it's good, especially reducing those medications. Watching how your child does, or anyone, is key. And also notifying your physicians. It's. I
Yeah.
think it's important to tell them. I think one thing that physicians would love to know is like what's going on. If Are you taking any supplements or anything else? And it'll help. And if they also know about it, they can help other patients as well.
Right,
Um,
exactly. I was really reluctant in the beginning, was like, do I share this, or, are we going to come off the radar? Like, and so I was really worried about that, but our team has been so wonderful,
right.
and they're like, well, if it's working, like keep going, because epilepsy, there's just so they just really don't know. It's been around for so long, but we've tried the keto, we've tried the medication, and not everything works with everyone. So there's different tools worth exploring,
Yeah.
and parents need to know that too, and ask the questions, and your team's behind you to help you. So just on top of the medication and the red light, like it's been a saving grace for us. It's been wonderful.
Yeah. No, it's good, and it was a saving grace for you to meet. I mean, unfortunately, you had to meet in church, and it was a blessing that you met and got that solution. Uh,
Yes.
there's a lot of people we meet. It's sometimes, I mean, personally too. I mean, I got into this space because it was through a personal reason. My dad needed it, and I didn't know this existed. And I did my training in medicine at some of the top universities here in Canada, but it's like I didn't know about it. And more often, physicians only know red light as a heat warmer for joints, right? infrared treatments, like for arm joint pains.
Yeah.
So the first question I got asked when I asked the physician, can I use it on my dad? Was that, oh, as long as you don't cook his brain. I mean, I
Oh,
said, no, 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 because that's all they know, right?
okay. Yeah. Yeah.
That's
Yeah.
all we know, right? And I said, no, no, this is near infrared, right?
Yeah.
And I also tested it out of myself and wanted to make sure, right? And I know that Tom's system actually cools down things so well that if you touch the lens or anything, it doesn't heat up. So even
Mhm.
that little bit of heat that the mechanisms produce is not felt on the surface of anything. And the
Right.
best part is it's as close to possible to the skin or the brain that you actually get the best benefit. But no, I'm glad. And oh, one more thing I remember was there was with the EEGs, what we were discussing.
Yes.
There was one case. I had a child who actually parents were just coming in just to assessment. This was a lady who we work with. She does QEEGs, and she was just doing for. She had also same thing, seizures. And the thing is, the child was not presenting. Parents thought she was perfectly fine. He was a he. He was perfectly fine, right? Because they thought the seizures were all controlled. But when they did the EEG, they realized that he was actually still having seizures. So it's really important to also don't shy away from all these tests because it actually gives you a better view of what your child is going through. So you could actually help them better objectively, right?
Right. And that's what happened with Rowan too. We didn't see all of these seizures happening. They had the habitual ones, but when we were hooked up to the electrodes and in the EMU, they were seeing so many. She was at school having these silent seizures and just, in gym class and not knowing what was going on with her, right? So I agree. Like these tests, they will help us, they will help these children's parents, like just go further and
Yeah.
and get the proper treatment, right?
Yeah, and same thing with labs too. And I think that that's something that people were asking here on this question about when I mentioned about the thyroid. They were asking about the labs, and yeah, no, definitely don't shy away from checking your labs, seeing your physician. Don't, it's your body, right? It's your body, it's your
Yeah.
child, it's your parent. Make sure to ask and just say, look, I want this test done, right?
Yeah,
Because that's
especially for your children too. You got to advocate for them, right? And everybody, a lot of the doctors, they know what they've seen, what they presented. They're going to help as much as they can, but ask the questions.
yeah.
Ask because you're helping, really, potentially you're helping. Epilepsy is still seems so new. It's been around for so long, but there's so many different types of epilepsy.
Yeah, and also with the medications too, you could actually lower the medicines because the kid is not technically snowed, right? That's what we call it. And it's like if you give too much of the anticonvulsant, if you overdose someone, you actually what happens is the kid is sleepy, drowsy, dopey.
Yeah.
I don't know what your experiences were, but at least that's what we're trained on. That's what we hear
We,
about.
yeah, we were definitely like that with the topiramate, but we had to slowly
Yeah,
bring it down. Like we did a load on her to try to help her seizures from having 56 a day. Like I could videotape Rowan and know she was going to have one every half an hour. And
yeah,
that was the only thing that kind of stopped us. And when we ended up leaving the IWK and going back to Ontario, she was having 32 seizures a day. So I mean, a lot of people are like, wow, that's a lot. But I'm like, oh, whew, we got some relief, And, but you just don't know, right? Their
yeah,
brain is evolving and it's growing so much. So we go from 2022 having our first seizure into 2025 and constantly having them because she's growing, right? And so her brain's growing. So now the seizures seem to be increasing.
yeah,
Um, and it's just it's ongoing. It's scary. It's very, very, very scary.
yeah. No, yeah, and yeah, yeah. Thank you for taking care of. I mean, honestly, I don't know what to say. It's hard. I've seen parents, I mean, struggling, and you guys are the heroes, really. I mean, you guys are the consistent part in a child's life. And I always tell like physicians and everyone else, you've got to listen to the parents. Like, if they tell you there's something wrong, there's something wrong, right?
Yeah. Yeah, it's true. I mean, you feel so guilty all the time, and you're wondering if you're doing enough. And then I do find in the beginning, I was relying on the physicians and our team was wonderful, but I was like, well, whatever you say, you're the professional. But really, I needed to take these notes and I needed to present to them what was going on with Rowan so that we could work together as a team and don't cut yourself short, right? And there's all these different potentials to help your child and you need to work with that team and don't feel small.
Yeah. And there's no one solution. If there was one solution, there would be a cure, right?
Right? That's
That's
right.
the thing.
Yes.
So it's a
Yes.
Wow,
complementary.
you, Kyley, I'm so glad you were able to do this. This is fantastic. And
Thanks
I'm
so
glad we
much
could
for
have
having
you
us.
on tonight, but it's going to continue, but I'm going to have to sign off any minute here. So, but I want to thank you so much for being on. And there will be questions. So if
Yep.
everybody wants to hang in there, we're going to have just a little bit of videos, and then we're going to go into questions shortly. But if there's any other things that you want to mention, but both Dr. Boone and Kyley will be around for the questions, and I'll have to let you guys sign off because I know they won't let me do this. I'm still sitting on the tarmac, so we're okay. We're not breaking any laws up here right now. So
One thing I think people are asking, like, there's one mention about one person said that their friend's daughter had 4 surgeries for epilepsy, and that's often sometimes for if there's a nidus or foci of seizure activity, that's sometimes a solution that people reach for. But has that ever been offered to you? Or I'm not saying that's a solution for your daughter. I'm just saying,
Well,
but like that's something that people do.
this is our next step. We have an SEEG June 22nd, and then there could be the ablation potentially at the end of it. If they do find what they need, any of the test results come about it, that's what they're going to do. 2 to 4 months, there could be the resection, but we are hoping that this will slow it down. Now, my question is
Yeah.
to after this happens to continue with the red light so then it will maybe that 70% success rate that we will get that with the red light on top of this since we've already come so far that this it would definitely um, help us get to where we need to go to become
Yeah.
completely seizure free.
Yeah, no, actually, it'll help. Even pre-surgery, it actually has been shown to actually help heal wounds faster because what you're doing is you're making the cells function much better. So prior to surgery, if you do it, it actually, like if you do it leading up to surgery,
Yes.
they find that the tissue stays much more vital and it heals much faster. That's one benefit.
Okay.
But immediately after any surgery, even for any condition, if you do it after surgery immediately, it's not a good idea because you have an increased risk of bleeding. So wait a couple of days and then do it. I'm not saying this is for Roland. I'm just saying in general.
Yeah.
For Roland also, there's also one more thing that people think about. Red light therapy is also known as low-level laser light therapy, LLT. So if you ever look up any journals for epilepsy, you might find research articles that come up with laser light therapy. That's still photobiomodulation. That's red light therapy, but it's not the intense red light therapy that they have recently started using for surgery. So your daughter may get the option of doing a laser, basically guided, basically laser treatment for the lesion.
Yes.
So what they do is they put a small little electrode in, and then they burn that area with the laser.
Okay, that's what they were thinking about doing at the end of it. They were doing
Right.
16 to 20 electrodes on the 22nd, and then they did discuss that there's a possibility of using the laser to do the ablation while they were already in there.
Yeah, so there's 2 different lasers. That
Okay.
laser hurts, cuts, burns. This one doesn't. The laser light or the research. So the reason I'm saying that is if anyone wants to look up any PubMed or any medical journal articles or even AI, seriously, use AI, right? Or go on to like Google Scholar or Perplexity or anything. And if you want to know, will this help me? Like, will photobiomodulation or red light therapy help my condition or issue? You'll come up with some of the resources. Not to say that you could blindly follow it, but just definitely you'll get a lot more resources than you would normally have with just a regular search. I think someone else asking here, was there any specific questions was specific to yours? I just want to make sure we didn't miss that. No. Oh, sorry. The other thing too is the medication wise. The reason I was curious about that was because you do get to lower it. Whenever for people who've used photobiomodulation, they tend to lower the medicines because the photobiomodulation augments whatever therapy they're getting. So you can actually lower your medication dose, which is great, especially with thyroid function. So someone was asking me here, like when should they do these labs? It's basically do your routine labs, but pay attention to the trend of the lab. See how like what your levels are. If the levels are going up, even though the medication's staying the same, then talk to your doctor and try to lower it, the medication, because the photobiomodulation may be helping you. The same thing with medications like for seizure activity. If you're finding the child is getting sleepier, that means you're giving too much medication that actually needed to treat, and you're basically making them sleepy. So you could always pull back on the medication, but always consult with a physician, because you don't want to like lower it too far and have a rebound or withdrawal effect. So always do that. Also curious, in your circle of friends, have you had other patients, like other people who've used for their child in for seizures?
No, no.
Okay.
No, I have not. I've actually talked to a few people that have
Yeah.
now reached out that said, "Oh, my child has seizures and epilepsy now too." And I said,
Yeah.
let's try this. Now we do have. There's a woman in town that has just opened a red light spa in our town, and it is absolutely wonderful. The people that are actually getting success through their joints and inflammation and whatnot in our little tiny town of Dunville. It has been wonderful. And that's what I was wondering. Could I potentially offer this to people in our circle to go and sit in that sauna, let's say?
Yeah.
I mean, they wouldn't be able to do the extreme heat, but she would be able to control that heat too. I know it's not as intense as the helmet, I guess you could say, but I mean, something along that lines too would help.
Yeah, it will. I mean, the key thing, the question is also, I just have to make sure that, like, as a physician, I always say, look, I don't want to give false hope, right? Because
Mhm.
we know that it helps based on some of the research. We don't actually have specific research to say that it will work on in human subjects, right?
Yeah.
Most of the research, unfortunately, has been done in animal studies. And slowly we're getting into areas where they're actually considering doing some studies. There's some early clinical studies being planned in England, one, and a few others are being planned, but nothing really has come concrete.
Mhm.
So that's why we always say, always look after the standard of care first, which is, go make sure you get your child checked out early, right? Those that we know, we have some treatments, so don't make your child have those seizures, because that actually burns brain, right? I mean, it actually harms your brain. The more the person has a seizure, which is not good. It causes brain injury.
Mhm.
So ideally, you want to stop that first. Then at least you have the connection to do like follow-up studies, and then you can augment it. Like exactly what everything else, like improving sleep is part of it, making sure your diet is good,
Yeah.
anti-inflammatories, like we know certain oils help, right? So all that matters. And nutrition is key
Yeah,
too.
I did really find the keto diet helped.
Yeah,
It was tough with Rowan being so young
yeah,
and sugar. Sugar. She was just like, "Can I have a treat?" And so that was really difficult
right.
with her. But we did know like the high fats and incorporating the MCT oils and the
Yeah,
avocados and stuff. Just trying to hide that, just to slowly start incorporate the
yeah,
keto. Maybe we can't just go all right away and jump into it, but it's something that I do believe as well, to incorporate that high fats as for any child as well, to anybody. I
yeah.
mean, for the brain function. But again, with the medication too, coming off of that with the clobazam and the cenobamate, they go hand in hand, is what I've learned. And with the red light, we have actually decreased the clobazam. And her physicians were like, "Well, we got to be careful because it goes hand in hand." But
Mm.
we were doing 10 milligrams both morning and night, and then the 150 of the cenobamate at night. And now we're only on 10 milligrams of the clobazam at night.
Right,
So that was really amazing, just to be able to come off of that, especially being on so many different types of medication right now,
right.
just to slow and control that, just to
Yeah,
be able to control it and have her sleep again, have her the patience, I mean, of a 7.5-year old. But it's
no,
nice to see her uh, just act like a child and have those struggles, opposed to we're reaching out to have breathing techniques, and just it was a hard long road for her to be able to just benefit from this, and it really has helped. It has. So
Oh, I'm so glad to hear. And Tom, that's Tom's goal, right? I mean, Tom
yeah.
has been working at this for a long time. And his philosophy when I met him, he's a very genuine guy. And every time he does it, he just wants to bring the, like, as he says it, bring the light, right?
That's
So,
right. Yeah, he's so wonderful.
and no, it's that's why I also always want to help him get the spread the message too. And the other thing too is also basically based on what your experiences have been and other people's experiences. One thing I would love for us to do is also get as many people who are going to try this with their child at home, so we could actually collate all that information together. So basically, create a network of people trying to figure out what works best and how much they're using it for, right? So that's something that we would love to also. So email us about that too if you're interested. We're also going to be doing a Parkinson's study as well. So because again, a lot of people we've noticed the benefit for some of the people who've tried it, and we've noticed the improvement in Parkinson's. So anyone who's interested, just email us. Or connect with us, and we'll try to connect you and everyone else. I mean, because we want to figure out is how best to use this light, right, to reach improve the child or improve the adult, and then move forward. Um, yeah, and also, so if you want, so they were asking me which email. So you could just use Dr. Heyman at sunpowerled.com or Tom at sunpowerled.com, and he'll forward it to. But I think that that's a key. And some people are also asking like palms. So one thing I noticed was with autism children with autism, uh, because their heads are smaller, you could actually use the palm light even in certain areas. So even for your Roland, you could actually do a palm light instead of the helmet if the helmet's too inaccessible for you. And it's portable too. So the reason I asked about EEGs before, and I mentioned that we're working with someone, is Rebecca, who's the person we've been working with. She's actually an expert on concussions, and also she and I just did a preliminary study on autism, and we purely used QEEG to identify which areas of the brain were sort of having abnormal function, right? So what we would do is look at it and say, okay, we notice these abnormal functions. Could you please try the palm if you're comfortable and on your child on the specific areas that we are noticing these issues? And of course, they already had their physicians all, treating them, no issues, right? Making sure they were all fine. They had full coverage. And so they did that. And sure enough, we noticed the child improving even within one treatment. So they would like regulation would improve. They won't escalate as fast. Small things like that. But those small things matter huge.
Yeah,
For
they're a
the
big win, right? The small
exactly.
things are a big win.
Yeah.
Yeah.
So definitely in cases where the brain is involved, definitely it would be good to look at it, and we already have the tools for it, which is QEEG, quantitative EEGs, which actually help you pinpoint the area that's affected, and that way you could actually, informed wise, you could actually go and target that area because oftentimes it's just a certain area of the brain that's affected in seizures or even autism that we're finding so far. But again, we don't know much about it yet.
Yeah.
Sorry, did you have more to add to that? Sorry.
Is the palm the same amount of time frequency as it is with the helmet as well?
Yeah. So we would say because the only thing is because it, unlike the helmet, which has 10, ideally, I mean, if you have the helmet, that's great. Just one, just quickly put it on and you're done, right? After that treatment. With the palm, you just have to move it around a bit.
Okay.
That's the only reason. But also it's portable. So and it's accessible. I think people are also asking about which palm. And so Palm has three palms. One is a Palm Professional, which they're phasing out because it's not as much received, but it's there. It's a Palm, which is a 660 nanometers and 810 nanometers. And he's got the Palm Ultimate, which is around 25% more power, which is 660 nanometers, 810 nanometers as well. And then the Super Palm, which is 660 nanometers and 1050. Now, for this case, and from what we know, for brain, we find that 810 has the most research in a lot of brain areas, everything from concussions to Alzheimer's studies and everything else. 810 has been shown the most. So typically for the brain areas, we stick to that. But others have actually noticed improvements with the 1050 as well. But from my perspective, what I've seen, 810 does a good job. Where the 1050 comes really shines is when you have joint pains, deep musculoskeletal issues, back pain, because those areas are deeper and you need to go through joints. So that penetrates much deeper and it does a good job there. That's the best for those areas. But there's no harm in using super. But for children, I tend to stick to the known numbers, which is 810 nanometer light and 660. So the Palm Ultimate or the Palm Professional do a good job for that purpose. The Palm Professional is not as intense, but it still gets the job done because we know the mitochondria circulate, and venous circulation and vascular circulation. You could actually treat that area, and you could have an effect. Um, so the sun, of course, is the best way to do it, but you don't get the full dose. That's the reason, because we're not out there as much as we can be to get that dose.
Great. Yeah, I think we're gonna hook up when he gets back to try the palm with Rowan and see how that goes. So we'll be able to let you know with that too.
Yeah, and also please get the QEG as well for your own benefit. You could actually ask them for it, and you could actually look into it, and so that way you also know which area to aim the palm at, and that'll help, especially with the auras too, right? When you know an aura is coming in, you want to put it over the area that's triggering it.
Okay. Stop. Excuse me. Go. Sorry.
Okay, no, who's there?
The dog is like, hey, what's happening?
Oh, and pets. It's amazing for pets.
So
pets.
No
yeah. Unfortunately, I had a Irish Wheaten Terrier, and I wish I had the Palm or something, which for his hip pain. So her hip pain. Sorry. That would have improved the pain so much.
Well, we have a 10-year-old silver lab that is feeling the arthritis.
Oh, use it. Seriously, use it. It works miracles. I mean, it really does. And there you can use it much longer. Any joint pain, any musculoskeletal pain, you can use it much longer. And I believe you're a personal trainer as well, right?
I am a professional bodybuilder.
Oh,
yes.
Bodybuilder. Sorry. Okay, then use it all over. I mean, it's amazing.
Yeah, I was actually using the helmet in the morning when I was doing some floor work, and my knees were really bothering me. So I was just throwing the helmet on my knees.
On the knees, right.
It has been a game changer. Yes, I do love it.
And also use it for your sleep. You moms have a lot of stress.
Yeah. And Rowan she'll throw that on, and I'll put her up to bed, or I'll jump in with her, but I'll, put the helmet on myself. It really, really does calm. Like even just that little bit of warmth, right? It's not hot. It's just, it's a game changer. And this morning I had the migraine. I had 2 auras. And so I jumped on with the helmet and I had the aura. I lose all the TV vision. And I thought, no, I'm not going to have one. And I went and threw it on. The vision it goes really quick. Like I used to have, I would say 24 to 48 hours migraines. The vision would go, I'd lose my speech. My throat felt like it would close up, the numbness. And then, you get into the vomiting and then the head pain, right?
Oh.
It's escalating. It's going so quickly now that I will go through that TV vision and then I won't have any more auras. It would just go right to that pain. And then I'm not out and about for a day or two. It's usually an hour or two and you're right back to it. And then I walked up to the gym and I came back and I started it. I felt it happening again and I threw it right back on and it was instantly like it's just wonderful. You can function again,
No, that's the important thing, right? I mean, it ruins your life. It ruins that day for you.
Yeah, it does. So I these people, they need to get on board. They need to check it out. It's so wonderful just to see Rowan, to see myself, to see us all like just thrive from this, right? And I can't, I don't know. I'm just lost for words because it's just, we're seeing it. We're seeing things happen and we're seeing us just be able to function again.
Yeah. No, that's what I'm really keen to actually. Let's interact with. That's what I was telling Tom and everyone in the office. Like anytime people actually have these cases, let's get all their information because that's the only way we can help others and also do more robust research into it because The problem is medical. You know how it is, right? Healthcare we want to be exact, right? Because we don't want to harm anyone,
Yeah.
and it's understandable, right? But sometimes also, like some of these technologies, I didn't know about it, and this has been around for 60 years. So this doesn't get out there unless it's
Right.
printed on somewhere. It's written about, and enough people have give us information to push it forward. And so I'm really glad. I mean, it's helping in multiple ways, and that's the thing, right? It it changes lives. It improves lives.
Yes. It does. And
Um,
I think everybody's always looking for the next, and don't get me wrong, like the next best thing, but
yes.
something, to help to push it through. And I do, I think just sharing the story, sharing, the research and everybody's successes, that it will definitely help. It'll help so
Yeah.
many more people, and we're seeing it, right?
Yeah.
So
And it's also one thing initially when I joined him, I was like, I don't want to smell snake oil because he was saying everything, it helps with everything. I'm like, what?
yeah.
You can't help with everything. It
No.
doesn't make sense. But it actually, I've been surprised. It does help. But that also goes to the fact that, we were created to be in the sun. We were created to, eat good food, drink water, right?
Yeah.
But unfortunately, in our modern world, we're not getting all that.
That's
And so it's a great discovery that they found out that the spectrum of red light, which goes from 650 nanometers to 1100 nanometers, has some effect on our cells. And that's been shown. And more we're finding out that it really works. So it's nice that Tom was able to pull down, to refine it, to get the intensity of the light
Mhm.
enough that a person can actually get a treatment rather than wearing like those face. Oh, another one thing that you'll find is those face masks people are buying,
Yes.
they're so underpowered. You need to wear them for like hours, not
Right. I
a
had my
day.
neighbor across the street. I was sharing with her, and she's like, I just bought myself one for Christmas. It's
Yeah,
not really working. And I'm like, well, it's a little bit different.
yeah,
But, it isn't as powerful. But I mean, you also feeling better about
yeah,
yourself, that's going to trigger it as well.
yes,
So
yes,
even just, yes, it's fixing everything. Well, that's going to make you want to look into the next thing and start the food and start the health and the fitness,
yeah,
because you're out and you've got the sun, and
yeah. And
yeah,
also, and the best part about Palm stuff, even the Palm device, for instance, right? The Palm Ultimate is only twice the price of some of those masks. And I'm like,
right,
the mask only does one thing and it's so underpowered. This one, it like does the facials. And you could do the facial in like 2 minutes or 3 minutes. That's it
right,
with the
right.
Palm device.
And
And
you can take it with you, and you can put it wherever, right? So
everywhere. Anywhere
yeah,
there's a pain, anywhere there's a wound, wounds help. It works beautifully for wounds, by the way. If you ever have a wound, just put it over, and it'll heal much faster. I think there's one person actually mentioning that AI search is also crap. Yes, AI is not perfect, guys. It's just that's why I said like use your judgment too. It's like don't send an email to someone after you edit on AI without checking it because it's going to be sometimes wrong. Same thing goes for research. But the good thing is it actually goes and searches really well. And for someone who really wants some guidance into whether this helps or whether there's some sort of a cure or some sort of a treatment or some research out there for your condition, don't hesitate to use it. It's a tool, right?
mhm.
Um, it's helpful. I use it, and of course we have some specific open evidence and so forth research engines, but it's still I recommend it all the time. I have no shame in recommending it. Go search it. Take it to your doctor if you want, because a lot of them also don't know about what's out there. Um, would it work better if you could okay, so email what is it? And some people are saying yes. Oh, you're welcome. Oh, they were asking about, oh, I don't know about some of these other treatments, but like for instance, I only know red light in this forum, so I'm not going to go into the other treatments that are out there. Um, like if someone asked me about Hashimoto's, it's a thyroiditis. Basically, it's inflammation of your thyroid. Yes, anywhere if you look up research, also they'll say it can help. Anything that has inflammation can actually help. Anything that's actually not working effectively, any cells that are like under functioning, it can help. The only precautions I always have, and this is what I've learned so far, is don't put it over cancer cells, right? At this point, unless you have a photodynamic therapy involved, right? That's the oncologists know about this. Photodynamic therapy means that you're adding a drug that gets sensitized by the red light and destroys the cell. But the only reason why we say don't put it over a tumor site is the reason is that not only just like it helps, red light helps with regular cells, a tumor cell could also be helped with red light. The reason why, that's why we don't recommend it. Tom actually has a company that he's working on. If anyone's interested, that I think he's looking for investment. It's a cancer-based company that actually uses photodynamic therapy, which basically uses a medication with red light. So that is safe. There's a lot of evidence for it. But please don't try it over cancer cells. But it'll help with other things. Like if you're palliative, it'll actually help with the pain. It'll help with the energy level. After your cancer is under control, you can use it for other things like wound care. You could use for aches and pains. That's not a problem. Brain fog, as long as the tumor is not in the brain, it could actually help you with that as well. So for eye dryness, it actually helps quite a lot. We've noticed that after people use the helmets, they always say that their eyes are much moist, and that's true. So for any physical changes like spider angiomas, someone asked me about spider angiomas, anything physical, it's not going to cause it to retract, right? Like varicose veins or anything like that, it's not going to cause it to go away, unfortunately. But anything that's like a subcutaneous hematoma, like a bruise, it actually can help it dissolve faster and heal faster. So if you've already got osteoarthritis, like bony formation, it's not going to cause the bones to be absorbed again. But what it will do is actually reduce the inflammation of the nerves that are getting irritated by that bony formation. But anything physically changed, red light, unfortunately, will not reverse it. Is there anything else in particular to epilepsy or seizures that you wanted to talk about, Kyley, or?
I do find that using the red light with that helmet, I do find the depression, the changes in frequency, the recovery time, that's a big thing. And not just for the children, but the parents as well, too. With the epilepsy, use the helmet. It will like increase your alertness. It's all around making us feel a lot better. Just taking that time with it and knowing that you are able to be patient with those seizures, and just that's my big thing with it, right? Like I find for myself when I use that therapy, like there was so many times that I've said it before, you just watch your child struggle and you're feeling powerless to fix it. But not only is this red light slowing down those seizures for your child, or that's what we've experienced, right? It's also slowing down for the parent. It's, it just kind of gives you that breath of fresh air. And that's what it really, really did for me. And your survival mode, it kind of comes back to normal. And you've got all the medication, you're doing everything that you can do, but you're going hand in hand, and your child's also seeing you use this as well, right? So you're feeling it all, and just kind of listen to your body and listen, feel that red light. It's been wonderful. So
it's as they say, put the air mask on yourself, right? The oxygen mask on yourself
exactly.
Yeah. No, the caregivers are definitely take care of yourself. That's the only way you can do best for your child. And we could probably talk in a future show. And Kyley, you're welcome to talk since you're also in this space. What we found was in the initial QEEG studies that I've done with the NFL players and with Rebecca and so forth, she's found that if you put it in certain areas on the red light, along with the palm or a helmet, is that we could calm a person down quite well. It actually works beautifully. It's only a few minutes too. And so not only, as you said, like mood, it also helps with focus. anxiety. And if you think about performance athletes, right, that's one thing that you absolutely need them to do. Like you need them to be very focused, clear their
Right.
heads going forward. And of course, moms are the ultimate professional athletes, but so
Thanks.
whatever helps you guys, it's important. And sleep is the
Yeah.
biggest thing that we always forget. That's the biggest thing that helps. I mean, with
Mhm.
red light, and that's the underlying mechanism is the lymphatic system, which actually improves the circulation there. So the waste products are taken out of your brain, um, and that's the theory behind that.
Okay.
Um, Sorry. And by the way, I should have used the red light on my nose because I'm stuffy here. Sorry, but it actually, if you ever have sinus congestion, do it over your sinuses, frontal sinuses or maxillary sinuses. It just clears it up.
Oh, that's good. My
Beautifully.
mom was just struggling with that the last couple of days. She's like,
Oh,
"Do you think I could try that red light?" I said, "Yeah, let's try it."
get a
Kidding me.
helmet on the face. It's the best
Okay.
facial. It's the best facial. It just clears you up beautifully.
Wonderful.
And then it's purely the red light. And also you can do a little bit of the near infrared too, and it works beautifully
Okay.
to clear you up. Um, Sorry, I just wanted to make sure we didn't miss anything. And I think I'm not sure whether they wanted to play a video as well, because Tom usually plays a video at the end. But
Okay.
just wanted to quickly go through here. Tom's flying right now. Yes. Great webinar, Kyley. So thank you again, Kyley,
Thank you
for
so much for having me. If I can just share,
no, thank
our
you.
story
No,
and other people
it's a
can
pleasure. It's a
reach.
pleasure for us to help, I mean, in any way, and also for you to tell us their story. And thank you. I mean, that's the key thing. Because I mean, even if it's like it would be great if people Tom's products, but Tom's products would work really well. But if people want to try it out, try it out. If it's going to help your child, just try it out. See if it's helping them. It doesn't harm because that's what we know from a lot of research. Red light does not harm as long as you know that the wavelengths are right and it's not laser based because laser we don't like as long as the lasers are the right frequency, but I'm scared about lasers because they could also harm.
Mhm.
But LED is fairly safe technology. There's been no reported harms. We've noticed that sometimes people overdo it and sometimes then they have like rebound effect or sometimes they feel headaches. That's why we go in small chunks of time. Like we give guidance about small chunks and use it at your discretion too. um, Brain fog, it does help. Uh, so Parkinson's, I've noticed benefit. Everything from apathy to slowness. The tremors actually go away after one treatment, which is crazy, or improves. But of course, the effect only lasts a few days. So there, you just need to redo, keep using it. I think, and yeah. Any final thoughts? Because I realize the time too.
Is there anyone else that, any questions about epilepsy at all with Rowan? I mean, I'm trying to help as much as I can, but we're still learning.
Yeah, and also, yeah, one person also said that it's longer use can cause headaches, but also heal memory loss. It's yeah. So that's the thing. It's you just have to know your own body. You have to listen to yourself too when you're doing this, and you're the best expert of your own body, right? So you'll know. And when you find that the effect, then you note it down and use it. Shakes, pain, numbness. Yes, it helps with pain. Numbness, yes, it works with peripheral. It works in peripheral neuropathy as well. And also, we could talk in the future about nerve recovery. We're looking into that as well. We've noticed peripheral nerve improvements and chronic pain as well. It can help. There's also different modalities. If people are interested in wavelengths and frequencies as well, we do don't. I mean, though our website does not have. We don't push the frequency part, like the 40 hertz, the 10 hertz. We can provide you with a box basically that actually can do that for you. So some people like to try out different frequencies based on what they've learned, and it can actually help. Yeah. So with that, I think I'm not sure whether Sam will roll a video at this end. So again, Kylie, thank you very much, and hopefully, the journey is going to be better for you and
Thank you.
going
Yes.
forward. And don't hesitate to contact us. And also, definitely do try the palm out during those aurora periods, especially for your
Okay.
migraines too. It works beautiful.
Wonderful. Thank you. Yeah, we are all on board.
Yeah. So thank you again. So thank you all for joining us, and hopefully this is not Tom. I mean, Tom. Unfortunately, Tom couldn't be with us for the full show. He'll be back next week, Tuesday. He is the guru of this, even though I still lead to him for the some of these historical answers as well, and his experiential answers too. He's a repository of a lot of information. So thank you all. And if you have further questions too, don't hesitate to email us, and we're very good at responding. And Faith and other people in the office are amazing. There's Faith, Jennifer, Janine. They all get back to you really well. Quast, if they have questions or if we can't figure it out, we'll internally figure it out and get back to you as well. And please do look at Tom's products because he's a very humble guy. It's a humble company too. It's all made in North America, by the way. It's all handmade in North America, and they stand behind their products. I'm not a salesman, but I definitely want to push their products, and they're really good people. So please do look at them. And if you have any questions, don't hesitate to ask us. And that's it. And have a blessed evening, and stay safe out there. And research it. Research all you want of your condition, of your health, because ultimately you're the one who knows more about your body and who cares more about your body. Others are there to help you, but if we don't know what you want or what you need, it's hard to help. Take care.
Awesome. Thanks for having us.
15 years back, I realized that light could make a huge difference on the body. I ended up designing this very powerful light using LED technology. With this amount of very high power density, it can reach through the tissues and travel right to the joints. But the key is that the power density and the area is extremely important to deliver that light into that. The mitochondria receives that light and converts that energy into the cell. So it's like giving the cells super high octane fuel, and they run like a jet, and they're able to do all the things for repair in that. What are the products we have? Well, we have a small device, which is actually large when it comes to light therapy. You have a fairly large area of light and a high power density that can be used for different parts of the body, like your finger, shoulder, back, neck, knees, ankle, anywhere on the body. And then we have what's called the mini canopy, which is about a foot square in size. And then we have our full-size canopy, which is basically 6 of the mini canopies. And then we have another device, which is the helmet, and that device can help for mental issues, for brain injuries, for concussions, for PTSD, TBI, all of those kinds of things. And there's new research out there that shows it could be helpful for not only strokes, but dementia, Alzheimer's, and Parkinson's, and just different brain issues. Our plans are to move this technology into every area of the world where there's pain and inflammation, which is basically everywhere, and to expand that so people understand all the applications where this technology can be used to help them in their health in the body as a wellness device. People are looking for how they can treat themselves without drugs.